our webinar, Elevating Employee Wellbeing Through Thoughtful Internal Comm Strategies. My name is Kelly McNamara. I'm the Digital Events Manager here at Staffbase. Super excited. I'm joined by Preston and Allie, and it's going to be a great webinar. We'll give everyone a few seconds to let us know where they're joining from. I'm in gloomy Pennsylvania. So the weather is not as nice as it was all week. I was spoiled with sunny weather. So please let us know where you're joining from. Allie and Preston, where are you guys at?
I've got the hot sun, early morning sun on my back here in Northern California.
Oh, I'm jealous. I'm in gloomy.
Sorry, I didn't mean to.
I'm in gloomy Massachusetts, and we also we had a thunderstorm this morning, which is definitely on brand for spring in Massachusetts. You never know what kind of weather you're gonna get.
Did you see someone?
No.
I was like, this weekend I saw on the news there was like so many tornadoes and everything in the Midwest. I was like, this is crazy weather.
Our hearts definitely go out to folks in Oklahoma.
Yes.
Just watching that. We were watching actually with family last night, just reminding ourselves, that those things happen and they're very, very real. But definitely want to send good vibes everywhere we're covering it down in the Oklahoma area.
No, definitely. And I couldn't say it better. So thank you, Preston. So let us know where you're joining from. Like I said, and it's all about wellness. We have a couple people from Kentucky, the UK, Canada. We have a lot of Canadians here. Florida's very hot right now. So I feel for all of you. Perfect. Well, this is all about, employee well-being. And we're super excited to dive right in. And I guess, we'll get started. So first I want to talk about what employee wellness means to different organizations before we just dive in of strategies. And Preston, if you can take this away, what you think, today's world of employee wellness means.
Absolutely. Thank you for that. And I was posting about the webinar yesterday, and I was watching myself writing, we're gonna have a fun webinar about wellness. So we're gonna do what we can. I know I'm on the West Coast, so I'm a few hours behind some of you, but try to bring the fun early morning. To kick things off, and I will of course answer your question, Kelly. Just a little bit more about me. You can see my title there. As I just said, I'm based here on the West Coast, but I work very much on the East Coast and all around the world. In Tactic, we are a strategy consultancy and creative agency only focused on communications, brand activation, and employee experience, all things people at work. I'm also really proud of the work we're doing with Tech Verified, which is our partner community of leading communications tech vendors, including Staffbase. So to get it out of the way, thank you to Staffbase for inviting me in. And I'm sure Allie will speak to that a little bit more. I know she's very familiar with the Staffbase world. But thank you for having me. Kelly, did you want to just introduce yourself a little bit before we dive in?
Yes, Preston's doing a better job at hosting than I'm doing currently.
I'm just trying to help.
No, I appreciate it. My name is Kelly McNamara. I run the digital events here at Staffbase for North America. So the LinkedIn lives that we run, the digital events, the boot camps, and the webinars. I'm usually behind the scenes. But
lot going on.
Yeah, a lot going on. One of my favorite parts though of my job is meeting, our wonderful partners and IC professionals and our customers. You guys always give me great insight. So I'm super excited to dive right in, and I'll pass the mic off to Allie.
Yeah, thank you, Kelly, and thank you for facilitating this event. And Preston, glad to be presenting with you alongside you. So I'm Allison Gillis, and I am representing South Shore Health, which is a nonprofit health system that covers the southeastern region of Massachusetts, south of Boston. So we have a hospital, we have ambulatory care centers, urgent care centers, and so we're a whole big network of a health system down in Massachusetts. And my area of responsibility is internal communications, and I work within the marketing communications department, and we roll up into strategy for the large organization.
Oh, that's interesting, Ali. When we were prepping for this, I don't think we touched on the fact that you were in marketing communications. and then up through. So that's interesting in itself, in the context of wellness, versus say other comms groups that may be sitting within HR. Maybe if we have time, we can hit on kind of systems and structure for supporting wellness inside organizations. So back to your question, Kelly. Thank you for teeing it up. When we were prepping for this again, we talk about defining what well-being is today, and I'm thinking about this a lot. This is coming up all the time. We are in the midst of a year of uncertainty. Let's call it what it is. We have, I think I heard yesterday, there's elections happening in 44 countries around the world, something like that. At minimum, right? Those are the ones that I imagine are the ones that we hear about. And there's a lot happening in the United States. There's other things happening in the economy that I'm sure we're all aware of. And whether it's conscious or not, these things are really meaningful to people at work. And I'd like to think that our job as communicators is to create platforms and opportunities for people to talk about this stuff and make some of that unconscious more conscious. We're also, as a piece of that, using this and really taking an opportunity to use this year to redefine what we mean by well-being at work, expanding upon kind of traditional definitions. Just for example, one thing I know we'll talk a lot more about is the context of digital well-being and how we can be more aware of what platforms and technologies, where the impact that they have or the influence that they have in our individual well-being. I'll hand it over to you, Ali. What else would you add to that when we think about what well-being means today?
Yeah, so working for a health system, health and well-being is so central to what we're doing. Primarily people are thinking about like their caregivers, they're helping patients stay healthy and helping them get healthy. But well-being is so much more than just physical health and wellness. And we know that, from speaking with our patients and the great behavioral health needs that we're seeing in our community, but also as caregivers, a lot of people are drawn to the profession because they care and they want to help and they're empathetic. But also, with that comes the need to make sure that we're taking care of our caregivers and how we're doing that. And, it's so much more than just providing very basic like health and wellness stuff, which, the chair massages are great that we do, and the chair yoga and stuff like that. And we continue to provide those activities and our employees really like them. But, especially during and after COVID, it's really uncovered an immense need for us to really do more to take care of our caregivers. From a holistic point of view. So we actually have a dedicated medical director of colleague well-being. And he's implemented a number of interventions with great support from, leadership around the organization to make sure that we're really taking a multi-layered approach to keeping our colleagues, feeling okay and well, understanding that they bring stuff from home into work, but also they're often dealing with very difficult situations at work. Traumatic deaths is pretty, unfortunate. Working in a hospital, especially, you see those sort of things. And what can we do to build resiliency and foster wellness within our workforce is very important.
I think just jumping off the what you're saying, Ali, the piece about what can we do to reinforce resiliency. I think that one of the first places to start is by really acknowledging all aspects of well-being. I mean, the physical stuff is the most obvious, right? It's kind of where many organizations default to, if you will. Traditionally, we need to make sure that we have benefits and programs and access to those benefits and programs to support physical well-being. What we're seeing is the impact of talking about emotional well-being and financial well-being and digital, as I touched on, beyond just physical, just to name kind of a few of the other kind of categories, if you will, really feels good. It really feels like when we acknowledge that there's many aspects of well-being as an employer, it feels, at least in the data that we're seeing, that employees are trust is being increased because it illustrates that the employer kind of gets it. It's beyond, how many steps did you have today, stuff like that. Or like you said, Ali, just beyond chair massages. So I think that, if there's any, I also it was when I was sharing the opportunity for folks to attend the webinar today, I said that we'd get to some specific tips immediately. And that's the big one. Take this, don't miss the opportunity this year to revisit the definition of what well-being means in your organization and include others, employees at all levels, ensuring that it's landing in terms of that new definition or the expanded conversation. So it's landing, and it feels like you're starting to talk about things that really matter to people.
I love how you both touched on resilience. And I think at any organization, especially Ali, obviously in healthcare, but really just in any occupation you have, there's always a time where you need to be resilient in life or in your profession. So to get both of your opinions, and Preston, maybe we'll start with you, is what role do you think internal communicators play in building that resilience in companies? Like, what are some tangible things that, IC pros can do?
Yeah. The first place I always start is, we don't just make this stuff up. Communicators, when we're tasked sometimes, let's be honest, we are with, let's sit down and create all these stories. Like, we don't just make these stories up. Our role as a communicator is to be a facilitator of dialogue, ups, down, and sideways, and to really understand what information and messaging matters most to specific people for specific reasons, right? There are lots of ways to share and communicate information or stories. We need to know what the most effective ways are to reach people, and that's where the important strategy comes in. But we're facilitators, we're story finders. We're not story creators. Like I said, we don't just make these things up. So to be real specific, to answer your question, all communicators, all of us, need to ensure that we have systems and processes in place so that we're constantly looking for and finding the right stories to build more awareness for things. In the context of wellness, that means we need stories at not just at the leadership level, but at all levels of the organization. And we need to really think about how to tell those stories in ways that align with our channels. How can we have a little short story in 3 sentences to build awareness for a wellness benefit that a manager can share at a morning stand-up? That's a challenging thing, yet really powerful when done well. And then, of course, on the other end, how do we truly engage our leaders to think about what stories are most authentic and meaningful to them in terms of how they're taking advantage of, say, specific benefits or programs available from the organization, from the company or organization, and what the impact those programs or benefits have on their lives, and the difference they're making in their lives of themselves, and the impact that's even making on their families. So that's the long answer. But our job is really to facilitate the right stories, the right ways, and then have processes in place to ensure that we're tracking them effectively.
I love how you said that. I know in our planning call you mentioned the story finders, and I think that's so. There's so many sessions I've been a part of, and yes, I see you're great storytellers, but really is about finding the story and really knowing what story to push forward into what audience. So I think that's a great insight. And Ali, how about you? I mean, resilience is something you probably have to do every single day.
Yeah, I mean, I work with people who are literally like saving lives every day. So I don't have to go very far to find incredible stories of our colleagues doing incredible things, and being very resilient and determined to be helpful and save lives. So for me, my approach is usually like I want to build trust with people so that they feel comfortable sharing these stories with me. And so that's taken, a couple of years to kind of get in front of people, meet people, have them understand who I am, what I'm trying to do. And to me, way that I approach it is I feel like it's a privilege to be able to like bear witness to
Hmm.
these stories. So obviously we have certain formats and certain goals that, you know, we want to use for our internal channels. But for me, I really like them to drive the process. And, you know, I really want to work with them to share stories of resiliency, bravery, in a way that they feel comfortable in doing. So that's kind of just a way that I approach my work. But, you know, really, like you talked about earlier, Preston, you know, I don't have to go too far. We have a really robust human resources department. We work closely with them. We're very plugged in with what's going on at the senior leadership level, and then, you know, also what's going on in the various clinical areas of the health system. So I think we've gotten to the point where, you know, we're well connected. We have regular touch points with them, and these stories kind of come to us pretty organically. And as a result, we're able to share them in an authentic way that I think resonates with people.
Yeah, you know, just a quick comment on the influence that AI has on our work. You know, I touched a few minutes ago on, you know, what AI is never going to replace is strategy development. And what I specifically mean is, you know, it's important to understand the distinction between strategy and planning. You know, AIs can be helpful with building plans with timing and tactics that we've defined as effective for certain audiences across certain channels. Strategy wise, it takes constant monitoring, constant attention by human beings. Quick little plug for my shirt. I don't know if you can see it. It says "Modern Humans at Work," and you know, what it's not only a tagline, but what we mean by that is that there's a human element to storytelling. Is my point that we can't lose sight of. And Ali, you touched on it in terms of kind of building trust and confidence with people to, you know, to find the right stories. You know, technology will never ever replace that.
Yep.
I'd like to, you know, as communicators, sometimes you know, I've even worked on programs where we frame story programs as kind of inside journalism. You know, we constantly need to be building trust, and then to your point, Ali, and then asking the questions again and again. You know, what does that really mean? What impact did that have on this? You know, what worked, what didn't work. So that was one piece, and the second piece, and kind of a question for you, Ali. How do you track and monitor stories at South Shore? Like, do you have a formal program for that? Do you partner with HR on that? You know, we're building something as basic as internet content, or wherever it is that we're sharing stories. Do you have any kind of perspective on what works to track and kind of manage multiple stories?
Yeah, so obviously we're a proud and very happy Staffbase customer. So we use Staffbase email to share stories, and we also have, you know, on
Okay.
the internet as well. We'll link to that content. So I'm constantly looking and pulling reports at least once a month to see what kind of content is really resonating with our colleagues, what they're
Very
interested
cool.
in.
Yeah.
And sometimes it's surprising. It could be, you know, the food trucks are back. Here's the food truck schedule for Food Truck Friday. Or also, you know, one thing that surprised me, you know, and kind of always thinking about ways to build resiliency and kind of reflect back the pride that we have working for the organization, reinforcing what we're trying to do. Just to take a little bit of a step back, we are a community hospital. A lot of people that work for the health system live in the area, so we are kind of like family, and you know, it's not unusual for us to be caring for our friends, our neighbors, even our own family members. So people feel very connected to the health system. And for me, it's, you know, I'm always trying to think of ways to highlight our connectedness, our, you know, familial sense for each other, this kind of like, you know, desire that we really love working with each other, and how can we bolster and, you know, each other and lift each other up. And so, you know, just little ways I'm always thinking about that as we, you know, every season we have our branded apparel store, which sounds like a fun little thing, but it's all of like our branding, but it's also like, you know, and fun things like we have the summer one going right now, and we have like, you know, like South Shore logo in the colors of the American flag, you know, also like, we have this really great shirt that says like happiness comes in waves, and like our, we have like waves and then our logo, because we have seagulls in our logo, and just like fun ways to kind of like build that sense of community, and keep reflecting back that we're all connected. We all really enjoy working for each other. We feel very connected to the mission, and how that helps to promote well-being and resiliency, because we're taking care of each other all the time in addition to our patients.
I love that. I do, Allie. I always get so impressed by how, I mean, you guys really do lean into your culture when you're doing your internal comms. I think that's so important because, like Preston mentioned, like just building trust is something AI cannot tell you how to do. So I do love that. We do have a question from Zane, who said, do you have any advice for communicating and supporting employees through new benefit providers? So I guess when you're, you're changing your providers and everything, how you communicate that. Preston, I see you nodding your head. So
we do. Look, I touched on that when we were kind of setting the table for kind of revisiting the definition of wellness, and it touched on, well, the world of benefits is completely changing. I did some work recently, and one of our partners is a captive. It's the worst name. They know it too, but it's basically where benefits and programs for many companies are packaged in a way so that and supported by a captive, meaning an organization that helps monitor benefits. The reason why I even bring that up is not only are benefits and programs evolving and expanding, but the way that they're provided and managed is changing. So when someone asks a question, like I think to Zane, first we need to ensure that we're facilitating, again, the right conversation with employees about the expanding world of employee benefits. And what tends to work is kind of contextualizing benefits within like total rewards, right? Everything that you get for working in an organization, and beginning to, just like in any kind of change communications, kind of moving through a campaign, for lack of a better word, from awareness. The world of benefits is changing so that we can ensure that we're providing programs to keep you well, right? Next, understanding specifically, here's what we're offering that's different now, or here's what's costing more, or here's where you could go to get benefits, or to take advantage of these benefits for you and your family. And then last, in the campaign framework and the action, go here by this time, or click here to learn more, and what that's one way to think about it. But I'd highly recommend looking at, well, first, getting some input from employees on, do they even understand that things are changing? Are they aware of what's new, what might be available, and what also may be sunsetted or going away? And, like anything, make sure there's a feedback loop in there to ensure that the people who need to know about the changing benefits know. And technology is very, very helpful for this. So, whether we see we target specific audiences or lists and groups, and we see the level of engagement of that information on a platform, or of course we need the human element of feedback loop of, let's really ensure that we're connecting with people managers to see the same kind of messaging. Did you know this is available? Do you have thoughts or feedback? Are you confused? Asking some of those basic questions. But I think it is really important to revisit how total rewards, inclusive of benefits and wellness programs, are being communicated today. Because like we said, in times of uncertainty, the unconscious is becoming more conscious for some people, and they are looking for programs to participate in to help solve for some of those concerns. And we do need to think differently about it now more than ever.
Yeah, and I know, Allie, in our plan called, you discussed, I mean, your company, your organization does have a lot of programs and benefits offered to your employees surrounding well-being and whatnot. How do you go about kind of pushing those initiatives, making sure that the employees are aware of them? I know you mentioned peer support or peer
Supporters. Yep.
Peer supporters. Yeah. If
Yeah.
you can go a little bit into how you I guess push that initiative. I think that'd be really helpful for our audience.
Yeah, so we have what are called peer supporters. So basically, colleagues nominate their peers, and when they, it's only 2 questions for the nomination form. It's like, who do you go to when you want to talk to somebody, and they just list who they talk to and who makes them feel better. And then the person who's the head of that program, our medical director, will follow up with the nominees and ask if they want to be trained peer supporters. So those individuals go through training to help be a peer supporter, which basically, active listening and helping connect people with resources as needed, understanding that, studies have shown that colleagues are more likely to go to a colleague, that a peer that they trust when they're, when they're struggling, versus, necessarily calling like, an EAP program or talking to HR. So this is a way to capture those people that are maybe struggling and then connect them with additional resources that we provide. So the peer support program, I think it's a little bit, like a novel concept for most organizations. So again, we want to make sure that people are aware of that the peer support program exists, and then they can nominate people, and then if people are interested in becoming a peer supporter, they can understand a little bit more about what that might entail. So it's a lot of layers of information. So it's really important to have, like, in my perspective, to have a dedicated repository of this information, because we might be talking about like, oh, we're looking for more peer supporters, and people might hear that and it's not relevant to them at that point in time until they're at the point where they have been asked to do it, or they're looking for a peer in their their unit that they can kind of speak with. So we want to make sure that people kind of have baseline awareness, and then continually, like, mentioning the program in various ways, whether it's like, we just completed our latest peer support training and there's a nice group picture of all the peer supporters. We also have special on our ID badges, peer supporters have a purple badge so people can see them, oh, that's a peer supporter right there. That's somebody that I can talk to. I didn't realize, Liz from billing is a peer supporter, and then she works around the corner from me. So that's kind of one example. And just from my perspective, I don't drive this program. I just want to help, raise its profile. And so thinking creatively, different ways that we can kind of continually be bringing this up. And, it might be subliminal for people, but to your point, Preston, make the unconscious conscious. So when someone is in that moment, they say, oh yeah, I remember that I saw something about peer supporters. Let me go to that page on our SharePoint so I can learn a little bit more.
Can we just stay on this for a little bit? This is so cool. And one of the things that we know is that it's very difficult for us human beings to hold ourselves accountable for things. And what that peer supporter program is such a great example of putting a system and process in place. In other words, providing permission to employees to acknowledge, you know what, I go to this person for this. Another kind of example I wanted to share is it's very challenging to replicate programs like peer support programs in organizations that have people working from home. And in the context of well-being, it's really important to constantly acknowledge how isolating it can be for people to be working, from places outside of an office. And what I mean is the office, like HQ or, whatever, where there are other colleagues there physically. And in the context of peer support, ask people, so when you can, if you're working in a company or organization where you can segment, because we all can, and we know who tends to work outside of an office or from home or wherever a majority of the time. And targeting those groups and asking, where do you go so that, or who holds you accountable for your own well-being beyond yourself? And providing opportunities. Say, for example, somebody works from home a lot of the time, and and then they go to the gym, and they have a trainer, or they go participate in a softball league on the weekends, or they participate in a basketball league, or if it's not sports, they may go to a cooking class or a knitting class. There's something that they do, hopefully, outside of work. But by at least asking that question, it begins to acknowledge, hey, it's okay to go look for that type of support outside of work also. And not only that, but we incentivize you to do that. So, tell us your stories
Yeah.
about playing softball on the weekend. Tell us a story about somebody holding you accountable for something in the context of your health, and well-being. And I'll plug again, we talk about well-being. It might mean I go on walks with my neighbor across the street in the evenings. It's not just about the walk, it's about the personal connection and
Mhm.
conversation. Or this is where I was able to go to take advantage of some tax advice that we get to help us move through some financial insecurity this year. And this is a benefit that our company offers for free financial counseling. That's those stories are really, really helpful, to kind of suggest that it's okay to ask for help, in any context, and we celebrate that. And then we always need to acknowledge that there are a lot of organizations that have people working from a lot of other places, and there are new ways of being well that we need to celebrate and ensure that people feel comfortable taking advantage of.
I do agree. I think, press on your point, and I'm a fully majority remote employee, and I
Mhm.
work with a lot of remote employees or hybrid employees. And what I've been seeing that's changed, especially since after maybe COVID or whatever, is that people on Slack or email will be like, "I'm going for a run. Like, don't. This is my run
Mhm.
time for an hour," or like, "I have a Pilates class," or. And I think the stigma of like, "Oh, are you not like?" Sometimes working from home can be longer than working in an office, or working in like it's working office, you get social interaction. So I do love how you mentioned that, and I think yeah, it's just it's changing. I hope for the better. But this
Yeah.
leads me to, I think, our next topic a little bit is that we talk about all these health initiatives and benefit initiatives and to support employees, and I do think that a big part of it is trying to get leadership on board. So I do want to kind of change a little bit of gears to talk about how what are some tips to get leadership on board with health benefits, but not only that, but how to kind of reduce the stigma surrounding mental health and how leadership can help
Mhm.
in that process as well. So yeah, I mean, I know, Ali, you said that your CEO is very involved in the community, but if you can talk a little bit about how, like, you kind of, I think at South Shore Health, I know you guys try to do initiatives to reduce stigma surrounding some mental health things. So if you can dive into that a little bit, that would be great.
Yeah. So, to your point, like our president and CEO is a medical doctor, so it's not a hard sell to say like, hey, we really need to be getting out there talking, having leaders be visible, talking about health, well-being. But one thing I think we're doing really well, and it's because of the support from senior leadership, is that we're doing a lot in the addiction medicine space and behavioral health space, both for our community, but I think also it helps our colleagues as well. We're very active in the community about raising awareness about opioid misuse and preventing that, and kind of working alongside community-based coalitions to get that message out to our community. And I think for, because we have messages coming directly from leaders saying, for example, we had recently recognized Black Balloon Day, which is a national occurrence where people, are coming together to acknowledge the lives lost from opioid overdose. And we participated with, as part of this day with the local coalition, and we hung, black balloons outside the entrances to a couple of our, facilities, and it was a very solemn
Yeah.
commemoration, and we wanted to make sure that we did it in a very tasteful, solemn way. And we actually had one of our VPs send a note out to everybody just saying like, hey, you're going to see some black balloons. This is what it means. This kind of like represents what's going on in our community, what we see every day, and how many of us have personally been touched by that. And we sent that message out, and he got a number of private replies back saying,
Oh
thank
wow.
you for doing this. This means a lot. I lost a family member, or we see this all the time in the ED, and it's such a problem in our community, and we're not happy, but it's meaningful to be
Mhm.
acknowledging what's going on. So kind of, I think, to have a message from leadership and then kind of show pictures of what we did, and then kind of remind colleagues that we have comprehensive, addiction medicine services available to our community, is important. And I think it really helps to destigmatize the
Mhm.
issue. And then hopefully, if people are struggling personally with this as colleagues, they know that if they're reaching out for help, that we're an organization that obviously understands this is a very difficult disease, and no shame. If you need help, we're going to connect you with resources, and we're well positioned to do that.
No,
Yeah.
I love that initiative. And I think you just mentioned this. I think it's so important that they could privately message your CEO and like that message and like respond to it, which I think is, I mean, as an employee I think that's such it builds so much trust. You know what I mean? And I think that's such an important um, aspect that you guys allow, because I know there's some cases where that's not, there's no way two-way communication. So I think that's really, really important. Um, and Preston, I know you gave great insight on how you can build that trust with leadership. And
Yeah, what's cool about amongst many things, the context of well-being is that it provides an opportunity for people managers. I think of leaders, I think of people managers, whether you have one
Mhm,
direct report or 100,000. And the context of well-being provides a really great opportunity to be authentic. I mean, I didn't make that. Everyone knows that that's how you build trust.
mhm,
And when we're looking at data, says we need to improve trust and leadership, the first place we go is how can we build more of a authentic relationship and connection with people at all levels. And when we do not find and surface stories to kind of build more awareness for some of the hard things that we all deal with, it's a big missed opportunity. And so, one pro tip, if you will, that I always love to share is the leadership brand exercise. And again, when I say leadership, it could be somebody who manages 3 people on a floor, or however many. But anybody who manages people, take a moment in time, and our job as communicators or facilitators is to provide a little bit of a framework for this, and that's what we call the leadership brand framework. Think of it as like personal branding for leaders. But one of the questions is, it's kind of a what's your story context, but it's in the context of wellness. What are some of the most difficult experiences that you've had?
mhm.
Interesting brainstorm. Well, how have those experiences influenced your life? How have those experiences made you a better leader? Very simple questions. And when we ask those questions, it gets people thinking. And, it enables everyone to then share those stories across, different platforms in different ways, to take advantage of this really great opportunity to build more of a personal connection and not miss the opportunity to build trust. So it is very much connected to the story piece, but creating time and space and sharing some of those probing questions is a pretty simple thing to do, whether we use technology to enable and facilitate that.
Mhm.
But there's, again, a human element. So for those that aren't sharing stories or aren't clicking on that request, they're not following through, it sometimes does require some personal outreach through other channels, like an email, or even some walk around conversations where you've got your board and you're asking those questions to kind of remind people to go back and think about those things.
All right. And I know, in our planning call, we talked about how that not every message needs to be sent by leadership or the CEO. So Ali, I don't know if you can touch a little bit about, how I guess you go about whether who should send the message, right? If it's
Mm.
from the CEO, or if it's from, you know, professional development or HRU or just people managers, how do you go about navigating what would resonate well with employees?
Yeah, I mean, those are definitely conversations that we have about every message, like all colleague message that's going to go to everyone. It's who is
Mhm.
the best person for this message to come from. And it really depends on the nature of the message. Sometimes it's from one senior leader, sometimes it's co-signed by multiple senior leaders. And it's really kind of asking those questions like, who is the most appropriate person? What's really going to resonate? The topic of the message, who most closely aligns with that work and who makes the most sense. Because a lot of times, half the time what I'm trying to do is explain who is the senior leader, what are they doing, how does that affect you? Because sometimes the titles can be a little bit obscure or confusing to somebody, especially if they're not working in a clinical space. So we do have those conversations about like being very thoughtful and intentional about who the message is from, when we're sending it, who we're sending it from, what the subject line is. Is this going from just the generic internal communications email, or is this coming from personally the president and CEO of the email, our chief medical officer? Who's the right person to send this message? Our head of human resources, what makes the most sense? But sometimes it makes sense not to have a message come from senior leaders. Maybe it's something that's organic that's come up. And, I know this probably sounds a little weird, but recently, I've had colleagues approach me who have wanted to share a remembrance of a colleague who's passed away. Like it's happened enough where it's like, okay, I got to start thinking about this. So I have kind of like a uniform approach about how we handle these types of requests. And, it's not just like, oh, here's a link to their, this person's obituary. They worked for the health system for 20 years. What I found was that, people were approaching me saying, I worked alongside this person for, 10 years. Our team is, obviously very saddened by their loss. And we wrote this to help, process and acknowledge their loss, but also their memories of working with them together. And so for me, I'm like, wow, that's really powerful. I want to put that out there. It's a little bit, I'm not saying every newsletter that I put out has an obituary note in it, but every so often we do it. And I think it really does resonate for our colleagues. It gives them space, like you were talking about, Preston, to work through some difficult feelings that they might be going through, to process their grief. It also shows that we're not just highlighting like, yay, we're so awesome. Look at all these great things we're doing. It's also talking about like, wow, there's some really tough things that happen around here. And we're creating space to talk about that. And just, I really let the person who's approaching me drive the process. But one thing I do think is important is I always like to make sure that I have permission from the family to share that type of stuff in our colleague newsletter. But other than that, I really let the team that's kind of approaching me that maybe worked closely with this person to drive the process and give them the space to kind of create this meaningful closure that they might be looking for. And I'm honored that they trust me to help them get this message out there and show other colleagues that we are, a family. Difficult things happen, and we're creating space for people to kind of work through that.
Ali, thank you for bringing that up. That's we talk about, like you said, sharing very real stories, and not everything has to be positive. There's also, it also creates an opportunity to really try new things in different ways. So to your point, it's not about a link to the obituary, and many of us as communicators are dealing with things like this all the time and sharing this type of, sensitive, emotional messaging and information. We had some concepts recently where we were tasked with, how do we think differently about sharing really hard news like that? And one of my favorites was, we miss Mary, we love Mary. Here are some of the things that Mary loved. She loved this, she loved that. Maybe we bring some of that, her favorite meal, into something that we're serving, in the food area, in the cafeteria, whatever you call it. But just really simple things that are meaningful and kind of linked to celebrating someone's life. And again, that's a very specific example, but the question is, how are we constantly revisiting our approach to things? And then within that, testing things and trying new and different things, because I think it's really important to stand out.
Yeah, and I definitely don't have all the answers. And so for me, I view my colleagues, they're my clients, they're my customers. And so I really want them to tell me what they need. And obviously, we're part of what I do is strategic communications. What kind of messaging from leadership do we need to get out there to make our colleagues aware of? But also, I think the other end of that is really like, what do our colleagues need to hear? What are they telling me? How can I amplify that and showcase that? So to me, I really feel like I'm like not a servant, but like I'm serving my colleagues, and I want to hear what they have to say and what's important to them and help them get that out there. I mean, they're so busy doing amazing things. And if they're taking the time to email internal communications because they want to get something out there, and sometimes I get these, kind of requests that's not going to work, but like, how can I reframe it or work with them that they still get something out of it, even if it's not exactly what they originally requested. So that's really important to me, and an approach that I try and take to my work every day.
I love that. I think that's so important as, an internal communicator. Like, you really have to have an open door and like be willing to change and trial and error. Because at the end of the day, life changes, society changes, employees change. There's so many things that are changing. So I think not being stuck in your ways and being open, I think, Allie, that's so important. And I know our last point, it segues nicely into our last point, because we talked a lot about kind of working with different departments and how it doesn't just take internal comms to care about, employee wellness. It kind of takes a village. So I wonder if, Preston, I'll start this question off with you, is how do you think working with different departments, as an internal communicator, working with different departments can help support mental health in the workplace?
And overall well-being. Yeah, I think that the first place that we always go is, and I have a big soapbox I like to stand on in terms of when the context of employee experience is effective and constructive and when it's not. And in the context of well-being, it's absolutely a great place to really kind of rise above a functional or function-centric view and take an audience-centric view, and really look to, if you don't have it already, hopefully a cross-functional group of people across IT and HR, marketing, service, and keep going, every function, hopefully facilities, safety. And in the context of employee experience, think about, well, what are our opportunities to kind of spark or ignite a conversation or ideas about what being well means every day. And it could be on the way to work. It could be when you come in on the facilities context. It could be in an HR context. Well, what are the opportunities that we're providing people to take advantage of benefits and programs we're offering to support well-being? In an IT context, how are we being proactive and building awareness about the influence of screens on our day? As we keep moving through. But when we think about core priorities of an employee, a cross-functional employee experience group, team, council, community, whatever you call it, well-being should be one of those big priorities. At least it's the most effective group across functions to really think about how to kind of move the conversation along, be proactive about building awareness and increasing participation in programs that help people be well.
No, I completely agree. And Allie, is there any, I guess, initiatives that you work with HR or IT that you can kind of, shine light on?
Yeah, sure. I mean, I just right off the top of my head, we have a bereavement committee. So it's a group of colleagues who are interested in making sure that bereavement resources are available to, our colleagues who may be dealing with a bereaved family or even a bereavement themselves. And how do we connect them with resources to kind of destigmatize grief and make it okay to not be okay, and linking them with resources. And also, a lot of people have a tremendous amount of insight and experience in this area, whether they're, because they went to school for it, or they're seeing patients at the end of life, or caring for patients at the end of life, or they've gone through difficult experiences themselves. So kind of bringing together a multidisciplinary group. So that's one thing that's kind of, and I'm part of that committee, and I'm there to help make sure that all the good work that they're doing and the resources that they're providing and that their existence is well known to the system. And I'm kind of on the other end of like the wellness spectrum. We have a plant-based advocacy group. So this group is advocating for more plant-based options, both in the colleague dining room, but also for patients. And so making sure that the work that they're doing, again, I'm helping to support internal channels, making people feel like they can be part of this committee. They can be involved in the work if they want to learn more about plant-based eating. They feel like this might be something that would be relevant to their patients. And the like. So those are just kind of some like grassroots things that I've been lucky enough to be aware of and get plugged into. In addition to the typical stuff that we've talked about, like through HR and organizational development. But just, kind of as a general tip, at least a guiding point in my mind always is like, how can we make the easy choice, the healthy choice, the easy choice for our colleagues? They're so busy. They're doing a million things. When I'm working with different groups, that's kind of always what I'm thinking about when I'm working with them. Is like, okay, how can we get them to know what they need to know in a way that makes sense for them, is going to capture their attention, and is going to make them the call to action be as easy as possible? Are they understanding how this might benefit them? So these are kind of always questions that are running through my mind. Especially, it's easy sometimes when you're coming from a certain perspective to think like, oh, well, we just need to do this. And it might not resonate with other colleagues that are outside that particular perspective.
So you spend, I mean, you must spend a lot of time building those relationships though with each department, because it's easy not to humanize. I think like my IT department, there's been companies where I'm like, I don't know anybody in IT. And I think it's so important for internal communicators when they highlight stories and humanize each department. So even employees who, weren't in internal comms would feel connected to be like, oh, I know Joe in IT. I saw him. I saw your story, Joe, about, the bake sale. Whatever it might be. I think that's just such an important concept. I want to say I know we're coming out of time. So if anybody has any remaining questions, please feel free to put them in the chat. We'll try to get them. I think this is for you, Allie. Kelly asked if you use digital signage. That's just a question. So I don't know. You do? Okay.
Yeah, so we definitely do digital signage. We have, being a health system, we have a lot of colleagues that are like working on the front lines. They're not sitting in front of a computer. They're not checking their email necessarily. So we found that, having digital signage strategically placed throughout our health system is helpful in making colleagues aware of what's going on. So typically when, if we have an important initiative or an important announcement, we'll create it in different formats. So we have it, ready, optimized for our colleague newsletter and for email. We have it optimized for our intranet, but then also for digital signage. And it'll say something like, visit the colleague portal for more information. So people see that. And again, I mentioned our dining room. So we have a really delicious, wonderful dining room that our colleagues love to go to for food. And so we're lucky that we have digital signage right outside where people are walking in to go to the dining room. So that's a really effective place to kind of get colleague facing information out there. I wouldn't use that as my sole way of like reaching colleagues, but it's a great way to reinforce and kind of remind people like, oh, there's going to be this presentation happening. We have this, vendor coming to visit and you can stop by the table and learn more. We have this important event happening, or sign up for your benefits and that kind of stuff. So digital signage is effective, I think, for reinforcing important messages. And we do use that given our, frontline workers who are not at desks.
I love that. Erica,
can I just add to that? We think about digital signage. It's passive, right? People are coming back. You don't have any data in terms of how many people are seeing it or what have you. But it's such a great opportunity to play back answers to questions. Like we did this one campaign where it was, what does a healthy you look like? Simple question, and we had all different types of answers. And we took all those answers and then included them on signage so that when people were walking by, it's like, this is what people say a healthy me or healthy you looks like for our organization. And you have a picture of somebody and you have multiple versions that represent different types of audiences. But it was just that kind of reinforcement type channel and messaging that reminded people like this is what we want to kind of strive towards. And then we visualize it in a simple graphic that people see. So quick little content tip.
I love it. Erica had a great question. What are some best practices or tips sourcing story leads for familiar stories, examples of folks using your benefit programs. So Preston, maybe we'll kick it off with you. If you have any tips or practices.
Yeah, when we think about editorial strategy and story strategy, whatever you want to call it, there's always that constant balance of business critical and surprise and delight. And it's usually like 80-20 or 90-10. I'd suggest going 50-50. There are ways to build awareness for certain program changes or new programs available that rather than say new and check this out, this is what it is. This is an impact it made in someone's life. This is therefore the value of that program. So having a story that is told through the eyes of different people at different levels of an organization to support existing and or new benefits and programs in that short form. It's like, how do you tell a story in 2 sentences? I know it's hard, but that is a very effective way. And then secondly, what the great thing about technology is that we can target information and messaging to different people by life stage, unlike we've ever been able to before. And having the life stage segments in our list management, in our data, in our profiles, if you will, is a really powerful thing. And a quick note on that is you don't want to make too many assumptions, right? People have children at all different ages, for example. People take advantage of specific benefits that are all different generations. Provide opportunities for people to add more detail to their profile, giving you that metadata you need to support targeting. So, there's a content element around stories, but then there's also a digital and kind of tactile element around, make sure that we've segmented audiences and we have data about people that enable us to target and share stories also.
Nice. And Allison, do you have any tips for how you source, how you find your stories?
Yeah. So, for me, I feel like a lot of it happens organically. Like I'll be in a meeting with somebody and they'll remember me from something else. And then I always, I'll say to people like, oh, if anything exciting or interesting is going on in your corner of the world, like feel free to reach out to me. So always kind of like planting the seed that my door is open, so to speak. Mm-hmm. I know this is not always possible, especially for workforces that are, mostly remote, but the benefit of a workforce that's in person for me is that I'm in front of people and like I can be walking through the hospital and maybe I'm on my way to go do something else and I see something. I see the colleague support dog is there and colleagues are petting the dog and I say, oh, can I stop? Can I take your picture for the colleague newsletter? And, and I, started this kind of fun campaign called All in the Family, where people that worked, I come and take portraits of people that work together that are related somehow. And that's really taken like a life of its own. I've gotten such a positive response to that campaign, but I've also got to meet so many people that I normally wouldn't meet. And that's really yielded some great stories and information that's come to me down the line and that maybe typically, wouldn't have had I not had that inroad with All in the Family. And it's always surprising to me what people will tell me when I'm taking their picture, just little conversations and I'll, they'll remember me, I'll remember them. And then there's always some future application that I'm like, oh, I did talk to somebody over in that department. They would be a good person to speak with. We're trying to understand X, Y, and Z or what's going on over there. They can probably provide some insight. So much of it is, for me, is building these relationships that yield content coming to me down the line. That's made my job, really easy and really fun in a lot of ways because people just come to me with these great stories.